Hello, very good morning. So, hope you are all doing great. I'm Nikita Kinya, and today I'm here with something really important. We talk about health, wealth, and everything. ಆದರೆ ಅದನ್ನು follow ಮಾಡೋದು when it comes to health is really challenging. And I think today to discuss about something really important in our lives, health ಬಗ್ಗೆನೇ health is wealth ಅಂತ ಹೇಳ್ಬೇಕಾದ್ರೆ health ಒಂದಿದೆ ಅಂತ ಹೇಳಿದ್ರೆ we can achieve anything in our lives. ಅದಕ್ಕೋಸ್ಕರ let's shed some light on particular disorders or diseases ನಮ್ಮ ಹೆಲ್ತ್ನ ಕೀಪ್ ಅಪ್ ಮಾಡೋದಕ್ಕೆ ಚೆನ್ನಾಗಿ ಇಟ್ಕೊಳ್ಳೋದಕ್ಕೆ and to be healthy, wealthy and also beautiful. Well, to start with, ಒಂದು ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಟಾಪಿಕ್ ಜೊತೆಗೆ ನಾವು ಇವತ್ತು ಸ್ಟಾರ್ಟ್ ಮಾಡ್ತಾ ಇದ್ದೀವಿ ವೆರಿಕೋಸ್ ವೇನ್ಸ್ and modern treatment approach. And we have a very well-known doctor in the city from Apollo Spectra Specialty Hospital, Koramangala, with 29 years of experience who is also a vascular surgeon, and varicose vein is his specialization. And he is none other than Dr. Vinay Nyapathi, Senior Consultant Vascular Surgeon. A heartiest welcome to you, Doctor.
Thank you so much.
My pleasure, Doctor. Let's hop on to the topic. We are discussing about varicose veins and modern treatment approach. Doctor, first of all, this is the question that we get in our minds. Tumba ಜನರಿಗೆ they may not be aware that they do have varicose veins. ಏನಾಗ್ತಿರುತ್ತೆ ಏನು ಗೊತ್ತಿರೋದಿಲ್ಲ. Or some people varicose veins ಇದೆ ಅದೇನು ದೊಡ್ಡ ಪ್ರಾಬ್ಲಮ್ ಅಲ್ಲ, we can actually solve it ಅಂತ ಯೋಚನೆ ಮಾಡ್ತೀವಿ. But there are many disorders or the challenges varicose veins ಇಂದ ನಮಗೆ ಕ್ರಿಯೇಟ್ ಆಗುವಂಥದ್ದು. So we are going to discuss about it. First of all, what are varicose veins and how do they occur?
Varicose veins is a very common issue actually. In the legs, most of the times we see varicose veins, bulging blue discoloration veins, bulging pipes, some people say. In the most probable, 99% of the cases we see in the legs, the lower limbs. So the cause why varicose veins come to the people is one most important cause is the genetics, anuvamshavali. In our hereditary, we see varicose veins. So as and when it's seen in our father, mother, or patient's father, mother, and grandfathers, the next generation will get around 60 to 70% of the people they suffer from varicose veins. So what are varicose veins? Varicose veins are, if we see, normally in the foot, from the foot, the impure blood from the foot goes to the heart in one way direction. So when it goes from the foot to the heart, there are some valves or mechanism. The valves ಅಂತಾರೆ, ಅಂದರೆ ಕನ್ನಡದಲ್ಲಿ ಕವಾಟಗಳು ಅಂತವೆ. ಆ ವ್ಯಾಲ್ವ್ಸ್ ಕೆಳಗಡೆ ಪಾದದಿಂದ ರಕ್ತನ ಕೆಳಗಡೆಗೆ ಆಕ್ಚುಲಿ ಪುಷ್ ಮಾಡುತ್ತದೆ. ಅಂದರೆ pushes the blood from the foot to the heart in the direction. When the valves are incompetent, when the valves are insufficiency, the valves are not functioning properly, what will happen is the blood won't go into the heart fully. Somewhere it reverses back into the system. So there will be reverse. There will be leaks. So the leaking pipes, what it causes is they cause bulging of these veins, and these veins are called bulging veins or the varicose veins. So many of the people, many people think varicose veins and takshanaನೆ they should see a bulging veins in the legs. Not all will be there having these bulging veins. Only around 30 to 40% of the people will have varicose veins which are bulging. So other 60 to 70% of the people, they have some other signs, like they don't have varicose veins as bulging veins, but they have some other symptoms and signs, like they have swelling, they have skin discoloration, and they have ulcers, wounds. So why? Because once the impure blood goes from the foot to the heart, when it leaks back, the impure blood falls back into the dependent portion, that is on the leg or the foot. That causes bulging of the leg. That's called swelling. In medical term, they say cellulitis. So many people, they have cellulitis, recurrent cellulitis. Bardana irtade. And especially people are having diabetes, they get repeated infections. They say it is cellulitis, they take antibiotics and they don't get scan done. So basically, once the blood comes back into the leg and causes bulging, there will be, after some time, after some years, 3 to 4 years, 5 years later, the accumulated blood, the impure blood, causes skin discolorations. What we call it as lipodermosclerosis. and this goes in for ulcers. So many people don't know whether this is because of varicose veins, because they don't see bulging veins, and they suffer with cellulitis, skin discoloration,
Correct.
ulcers. The mistake, and they go to some other doctor, some other skin specialist, or a neurosurgeon or a neurophysician, and the diagnosis won't happen, and they suffer eventually.
How are varicose veins diagnosed?
So this is very important. Once they see these symptoms or signs, like bulging veins, some people say skin discoloration, as we discussed. Some people have swelling, recurrent swellings. So when they have itching, cramps, they have a suspicion that their legs are showing some restless leg syndrome like features. Some people will have nocturnal cramps, nighttime, ರಾತ್ರಿ ಹೊತ್ತು ಸೆಳೆತ ಅಂತಾರೆ, ಆ ಸೆಳೆತ ಜಾಸ್ತಿ ಇರ್ತದೆ, ನವೆ ಇರ್ತದೆ, itching for the skin when there is skin discoloration in the skin. So some things like this, some pain more in the evening times rather than in the morning times. These are symptoms. So some symptoms like this raises a suspicion for the patient, and the patient goes to the doctor, any vascular, a good vascular surgeon goes there. Then the vascular surgeon tells them, get a color Doppler scan done. What is the reason for all these things? Is it because of vascular problem, or is it because of anything else? Once the color Doppler scanning has been done, usually we should do a color Doppler scan test in the standing position, because the impure blood goes against the gravity to the heart. So the distinction of the veins will be better visualized when the patient stands while doing the color Doppler scan. Once we do the color Doppler scan, we know what is the cause for this problem. So color Doppler scan is the most important thing, where we know where are the leaks happening, what we call it as reflex of the impure blood back into the system. We will identify this, and also we can identify what are the reasons. Is it because of the reflex, or is it reflex is due to the blood clots like deep vena thrombosis, or is it because of the valvular incompetence? So depending on the severity, they give the report, and once the report is being done, then we know what is the cause. So most important, when there is a suspicion for varicose veins and they have symptoms, the first thing what the doctor advises is a color Doppler scan. So what is the most important problem which is the patient is suffering ಅನ್ನೋದು ನಮಗೆ ಗೊತ್ತಾಗಬೇಕಾಗುತ್ತೆ. So when we see the patient, when there is swelling, skin discolorations, and we ask the patient whether pain is there, cramps are there, swelling is there. So these things will make us feel that this may be a vascular issue. First thing, if there is a knee pains, like patient sitting, squatting, and standing, or when he's walking, not able to stand for long, these things relate to a knee joint pains. And some people having sciatica problem with back pain, they have back related issues causing leg pains. We need to identify this. Some people, most commonly we see diabetic people having pains in the legs, like burning pain, or maybe some sort of a numbness in the foot regions. So these pains we need to relate, and we need to diagnose what kind of pains these people are having. Once there is a diagnosis that it is main cause of this leg pain is because of the vascular problems, and then we need to guide them whether these people are having what kind of, how severe the disease problem is. If the patient is having severe problem of pain, nocturnal pain, swelling, and when we do a scan, when the size of the veins are quite large and it is chronic disease, we advise them to go for a advanced treatments like laser or super glue techniques. Or if the patient is having early stages of varicose veins, and then we tell them that it's the issues, pain is not much for the patient and cramps are not. He's just worried about small white spider veins which is coming out of the skin. Then we tell them you exercise. If there is weight gain for the patient, then we tell them to reduce weight, do exercises for the calf muscles, especially yogas, keep walking, jogging, all these things, so that all these things help the calf muscles strengthen. See, we have no some when the leg, when the blood gets pushed into the system from the foot, the calf muscle acts as a very important muscle to push the blood from the foot to the heart. When that muscle is not strong, so it's very
Right.
difficult for blood to push into that system. So we need to tell them do exercises, do yoga,
Right.
strengthening exercises to improve the calf muscles. If it is early, when we do a scan, if it is severe, then we tell them to go for an advanced techniques.
I think no matter what, taking care of health is really important, and regular exercises, eating good, and feeling good is really important. Or else, ಇದು ಎಷ್ಟೋ disorders or diseases start ಆಗುತ್ತೆ ಅನ್ನೋದ್ರಲ್ಲಿ actually doubt ಇಲ್ಲ. In fact, talking about the varicose veins, doctor, are there any emergencies in varicose veins?
Most of the people who come to me are patients who are in the last stages. They come when swelling has happened already, when there is skin
Okay.
discoloration. They'll be applying ointments on the skin because of severe itching, and they'll have ulcers. At that stage, it is when the infections are there, then we have to use an emergency. But some people, because of negligence, they develop superficial venous thrombosis. ಅಂದರೆ ರಕ್ತ ಹೆಪ್ಪುಗಟ್ಟೋದು, blood clots ಆಗ್ತಾ ಇರ್ತದೆ. A blood clots ಆಗಿ ಒಂದೊಂದು ಸರ್ತಿ it goes into the heart and causes pulmonary thromboembolisms. Of course, these are all quite rare, but we have seen cases like that. So these are all negligence, and some people develop because of the high pressure in those bulged veins. These bulged veins, they just burst, they just leak, and patients without their knowledge, they lose around 500 ml to 1 liter of the blood, and they will not have pain because of the pressure in the veins. That the blood is not going up into the system; it's coming back. That builds up the pressure in the vein that causes a leak. This is called. Many people develop this bleeding. These are the same emergencies to emergencies, but more or less patients, because of the lack of knowledge regarding this disease, they neglect. Doctor, if I leave this problem, what will happen? So many people, what they do is they have pain, they have cramps, they have itching, they have swelling, they have a advanced disease of varicose. They take tablets to kill the pain. So there are no medications for varicose veins, and what all apply for ointments for itching and all, they are very temporary. In fact, all the skin ointments, they have chemicals like steroids and other things. So that causes even more harmful. The skin becomes even more less immune and it's prone for infections. So when it is untreated, uh, they'll have they have the last thing is they have an ulcer. So the skin problem, skin blackness of the skin, it happens, and when it progresses, what will happen is it becomes an ulcer. Some people develop infection, severe infection. Some people develop so much that it becomes a septicemia and they get admitted in ICUs and all. So they have blood clots, they have ulcers, they have bleeding, they have skin problems, they have all kinds of now because of lack of blood supply into the legs and the increased pressure in the interstitium tissues, the normal cellular osmosis also gets affected. And people in the studies, recent studies, they have shown that chronic varicose problems, chronic people having varicose issues since long, they develop joint problems, arthritis. So all this because of lack of blood supply, blood related, the pressure issues. These causes other symptoms, other problems like joint problems, like knee joint arthritis, osteoarthritis. The people who are having chronic venous insufficiencies, they have a tendency to develop early osteoarthritis of the knee joint.
So I think that's really important. So varicose veins ಇದೆ ನಿಮ್ಗೆ ಈ ರೀತಿ symptoms ಇದೆ ಅಂತ ಹೇಳಿದ್ರೆ all the followers or the viewers ಅಥವಾ ನಿಮ್ಮ loved ones, if they're going through this, that's really important to get it treated. Right. Doctor, going ahead, so how is laser surgery or laser ablation performed on varicose veins?
So once the patient is having these symptoms like pain, cramps, swelling, like discoloration, skin discolorations, ulcers, wounds. So when the patient is having severe pain, nocturnal pains, nocturnal cramps, once we do a scan and there is a diagnosis of severe reflux of this blood back in the system, we advise them for a endovenous laser treatment. So as of now, in this era, endovenous laser treatments is order of the day. And endovenous laser or endovenous super glue techniques. So the laser surgery is a daycare procedure. People come in the morning and they go off in the evening.
Mhm.
It's a daycare procedure. It takes around 20 to 25 minutes surgery for both the legs, and there is no cutting or stitch on the skin, or there is no spinal anesthesia. So we do it in a local anesthesia method, and after the surgery, 2 hours rest. After that, we encourage the patients to walk for at least 2 to 3 kilometers so that the blood supply improves. So the laser is a wonderful technique. There's no stripping like previously we used to do venous strippings, we cut it, and very barbaric methods. Because of that, there will be, used to be more of morbidity for the patient.
In this evolving era, in fact, every field has advancements. Sakashtu techniques and technologies ಎಲ್ಲ introduce ಮಾಡಿರ್ತಾರೆ. And meanwhile, when it comes to varicose veins, are there any advancements, or I think I should put it this way, can you shed some light on the advanced techniques on about varicose veins?
So the yes, there are laser beyond laser endovenous laser procedures. We do radio frequency ablation, the same technique, which has got a 95 to 98% success rate. And the recent one onset is FDA approved super glue technique. So what does laser do? See, the laser, what we do is wherever the leaks are there in the blood vessels, the laser, we identify that, we take the ultrasound machine, the portable ultrasound machine, into the operation theater. With a real-time navigation, we see the vessels, and then put a laser within, like a refill-like wire into the vein, and close the leaks. And similarly, instead of laser, now there is a technique called Vena seal or super glue technique. So what we do in laser is we do with heat. Laser is a heat energy based closure mechanism. So the laser introduces heat, and with the heat, the leaks gets closed. But now, without the heat, a chemical like a glue has come in. Just when it's also endovenous procedure. We inject around 1 ml to 5 ml of glue into the particular vein and close the system. So in super glue technique, this also takes around 25 to 30 minutes for each leg. And here, when compared to laser treatments, in laser treatment there is no cutting, stitching, or spinal anesthesia. But then we give local anesthesia in laser treatments. But in super glue technique, there is no cutting, stitching as in laser, but we don't give local anesthesia also. So patients who are undergoing the super glue technique, they don't need to take rest even after the surgery, because in laser we tell them to take rest for 2 hours post-op and then walk back home. But in super glue, there is no need for taking rest post-op. So after 10 minutes after the surgery, 15 minutes, they can just walk back home. This is the beauty of the technique of this super
Right.
glue. So this is the latest technique in varicose veins.
Yeah, it's mesmerizing, the medical technology advancements ಇದನ್ನೆಲ್ಲ ನೋಡಿದಾಗ. And meanwhile, doctor, you have been mentioning that diabetic patients ಮತ್ತೆ blood pressure ಇರುವಂತಹ patients will have adverse effect because of varicose veins ಅಂತ ಹೇಳಿ. So what is the treatment for them?
So many people who have diabetes, especially, uh, they neglect thinking that the leg pains is because of diabetes.
Yeah.
So these people who are having varicose symptoms, swelling and skin discolorations, they should be watchful. Why? Because diabetes people are more prone for infections. So once when they easily get the infections in the legs. So once there is swelling in the legs, it is easy for the microbial microbes to attack the skin and cause infections. So we advise people having diabetes and vascular related varicose veins issues, problems, to get the surgery done as early possible, because it will complicate for many of the diabetics. One, and for blood pressure, having high blood pressures, since we do laser in a local anesthesia, there is no harm in any way in doing for people having high BP, because we don't give general anesthesia or spinal anesthesia. We just give a local anesthesia and send back the patient. Only people having very low heart pumping, like the ejection fractions are very low, then we tell them we of not help when we do for such kind of patients. But then, for in case of super glue, we don't even give local anesthesia. So it's like patient will have a lot of benefit. People were undergoing this type of techniques instead of the older methods.
I think that's really important. And varicose veins ಬಗ್ಗೆ ತುಂಬಾ information ಕೊಟ್ಟಿದ್ದೀರಿ, and that's really helpful. They might be, facing varicose veins, or they do have varicose veins, so definitely they can consult the doctor, Dr. Vinay Nyapathi at Apollo Spectra Hospital, Kormangla, Delhi. And meanwhile, doctor, at the end, before we wind up, what is the message that you would love to give to our viewers right now?
So maintain good healthy legs, good health. Uh, uh, do exercises, regular exercises, at least 4 days in a week. Strenuous exercises so that your leg muscles, your body overall. Many people ask me if I do walking or running, do the varicose veins increase? A bit of when there is increase of blood supply into the legs, when there is already a patient is having varicose vein, they may develop a bit more varicosities. But then, not doing exercises, walking is not good. It is good, not good for the health. Doing exercises, regular exercise helps the heart conditions, improves the lung and overall well-being of the body.
And yes, I think this is how we wind up the session. That was really informative. ನನಗೆ ತುಂಬ ವಿಷಯಗಳು ಗೊತ್ತಾಯಿತು varicose veins ಬಗ್ಗೆ. So if you want to consult Dr. Vinay Nyapathi, yes, of course, he is available at Apollo Spectra Hospital at Kormangla. And ಹಾಗೇನೆ 29 years of experience. He is a senior consultant vascular surgeon. In spite of your busy schedule, you have been here, doctor. Thank you so much. And this is Nikita Kire for you.
Thank you so much. Namaskar.
Yes.